my name's Dee Jones and today is the 13th of May 2013. Today in my skills assessment video I'm going to be measuring a pulse rate, I'm going to be measuring a respiratory rate, I'm going to be palpating and auscultating a blood pressure, I'm going to be doing a chest auscultation and I'm going to be doing a full GCS score. And my patient today is 78-year-old Mrs. Jones. So is it okay if I take your pulse today, Mrs. Jones?
Yes.
That's fine. Have you had this done before?
Yes.
Yes, okay, so I'll just take your arm if I can. I might put it on this pillow. Is that comfortable there for you?
Yes.
Yes, okay, I'll just put my fingers here if that's alright. So I'm measuring the patient's radial pulse now for 30 seconds. It's quite regular, so I'm only going to measure it for the 30 seconds. If it was irregular, I would be doing it for 60. While I'm doing this, I have an open body stance with the patient. I'm also using appropriate eye contact. I'm also using the right haptics or touch to reassure her. And I've used the right proxemics, so I enter the patient's personal space. So now without letting the patient actually know, I'm going to also measure her respiratory rate. I just don't want to let her know because if they know that I'm watching her breathing, it can often change the result. While I'm doing this, I've also used the right use of silence and pauses for the patient. I've also used non-word noises such as and a hum to reassure her. I've used the right amount of touch once again, and I've also used appropriate eye contact. Okay, so that's great. So Mrs. Jones has a pulse today of 66, and she also has a breathing rate of 14 breaths per minute. So Mrs. Jones, while I was doing that, I was also checking your respiratory rate. Has anyone ever measured that for you before?
Yes.
Yes. Okay, so you know what it's usually around at all?
That's fine.
Yeah, 14? That's great. Okay, and do you feel like you're having any trouble breathing at all?
No.
No, or any effort?
No.
Use? No, that's great. Okay. So is it okay if I take your blood pressure today, Mrs. Jones?
Yes.
Have you had this done before?
Yes.
Okay, great. So I'll just pop this cuff on you at the moment if I can. Just let me put it on that. Might put your hand on this cushion again to keep it comfortable. Is that relaxed for you?
Thank you.
Okay, great. So I'll just put this on you. Sorry. Now when I'm inflating the cuff, it could get a little bit tight, but that shouldn't last for too long. Okay. So now I'm going to find Mrs. Jones's radial pulse and pump the cuff up until a point when I can't actually feel it anymore. Then I'm going to pump it up about 20 past this and slowly let it out until I can feel it again. When I start to feel this pulse again, that's her systolic reading. So Mrs. Jones has got a systolic reading of 110 at the moment. Now I'm going to pump up the cuff again, but I'm going to auscultate her pulse this time to find a diastolic reading as well. So I'll pump it up to 110 and then I'll pump it about 20 further again. And then I'll listen for the crack of sounds once I've found our brachial pulse to have a reading of when it starts as a systolic and when it stops as a diastolic. Okay. So I'll just pump up the cuff again, Mrs. Jones, if that's okay. So I'm pumping it up to 130. And then I'm going to slowly let it out until I hear those sounds. Okay, great. So Mrs. Jones has got a pulse of about 110 on 70 today. Does that sound about normal range for you at all, Mrs. Jones, if you like?
Yes. That's good.
That's awesome. Okay, so is that comfortable for you, fine sitting there?
Yes.
Okay, so whilst I was doing this, I was using appropriate eye contact with the patient. I was using the right amount of touch or haptics. Also, I was in her personal space to do the assessment. And I had appropriate eye contact to reassure her. Okay, so Mrs. Jones, is it okay if I do a chest auscultation today?
Yes.
If I listen to your chest?
Yes.
Yes, okay. Have you had someone do this before?
Yes.
Yes, okay, great. Do you just want to sit forward for me a little bit? If that's right, you can lay your hands on your knees. That's great, okay. And I'm just going to have a listen to your chest. If you just want to take a little cough to clear your throat. That's great. Okay, so I'm just going to listen to a few points on your chest. Did you want to just take a nice deep breath in through your mouth and out again? That's great. And again. So if I was doing this on the road, I'd actually ask the patient to lift up their top. But for this video, this should be fine. I asked the patient to cough so that she cleared any sputum that might have been at the top of her chest that might affect the sounds. And just listening to hear if left and right sounds are equal, or if there's air entry to their bases, and to make sure the sounds are normal, there's no wheezing or crackling or anything abnormal. That's it, Mrs. Jones, keep going. I've used appropriate haptics or touch to reassure the patient. I've got my hand on her shoulder. I've also used appropriate eye contact when explaining what's going on. I'm in the patient's personal space while doing the assessment, and I've got an open body stance the whole time. Okay, that sounds really good, Mrs. Jones. It's quite clear. Do you feel that your chest is feeling quite clear at the moment?
Yes, I'm fine.
Okay, that's great. And I'm just going to do a patient assessment of the patient's GCS. So Mrs. Jones is spontaneous eye movements the whole time. She's been following my conversation, so I'm going to give her a score of 4 for that one. Mrs. Jones, are you able to tell me what the day is today?
It's Monday.
It's Monday. Okay, and do you know what the month is?
It's May.
It's May, okay. And do you know what season it is? Sorry.
Autumn.
Autumn, that's great. Okay, so Mrs. Jones is orientated to time, person and place. So I'm going to give her a score of 5 for verbal. And she's talking in full, clear sentences, which is really great. And if I put my hands out like this, you able to just reach up with both hands and squeeze them? Give them a good squeeze.
Yes, I can do that.
That's great. Lovely. Okay. So I'm going to give Mrs. Jones a score of 6 for movement. She's able to obey my commands and give my hands a good squeeze. So I'm going to give her a GCS of 15. And whilst I was doing this, I had open body stance with the patient. I used appropriate eye contact. I also used pauses and non-verbal sounds where it was really where it was appropriate to reassure her, and I used the right form of touch.